joining me, YouTube. It's good to see you again. And this is Psychosis Part 1. What is psychosis? So I'm going to be talking about defining the illness today. I'm going to be talking about how it is experienced. There's 3 areas that it's experienced that I'll go through, and just give you some information to give you a nice introduction to psychosis. It's a term that maybe is thrown around, things like, psychotic and all of these words, or psycho and things like that. Psycho actually refers to psychopath, which is totally different, but psychosis or psychotic, these are the terms that maybe we've heard of but maybe not really understood. So I'm going to give you a nice introduction here. So I've taken a lot of this information today, well, most of it, from Rethink Mental Illness. That's rethink.org. They have a fantastic information part on their website that goes through all the illnesses and all the different aspects of mental health, mental illness. So I've taken the information about psychosis and I'm going to go through that now. Psychosis is a medical term used to describe hearing or seeing things that do not exist, or believing things that other people do not. So it's a different reality that people go into. So if you have experienced a psychotic episode, if you have experience of psychosis, then you will have seen things that aren't there, heard things that aren't there, maybe even smelt, touched, or felt someone who isn't there. And it's a very, very scary place to be, but I'm hoping to make it less, making it a little bit more easy to understand and accessible in this video, because it is a very, very scary part of mental illness. I have experienced psychosis in the past. Mainly for me, it was experiencing different smells. I would smell bad, like I smelled really, really bad, like of BO, or really, really horrible stinky smell. And I'd be like, when I was at my very poorest, I'd be like, I smell. And my mum and my boyfriend would be like, you don't smell, but I was like, I do. And I kept putting clothes on and then taking them off because everything I owned smelled. Of course it didn't, but I was quite poorly at the time. So that's one area. But basically, a lot of people think it's kind of, they see it as a break from reality, or they're not. Some people really kind of go, okay, I'm accepting of this, I know this isn't real. Other people maybe have experienced it once or twice and it have been absolutely terrifying. Everyone's experiences are different because we're all individuals. But you may hear other terms such as psychotic symptoms, psychotic episode, psychotic experience. A lot of people who go through, who have psychosis, talk about it as an experience rather than as sort of signs and symptoms like I've talked about with other illnesses. Approximately about 1 in every 100 people will experience a psychotic episode in their lifetime. So I've talked about, I've introduced that. Hopefully that gives you a better understanding. But there's 3 areas which people's experiences are affected. So you've got hallucinations, delusions, and cognitive experiences. So let's talk about hallucinations first of all. So these hallucinations, when you see something that isn't there. Now, that sounds very, very scary, and it can be. I mean, it can take the form of many, many different things. Some people who have psychosis may experience sort of creatures moving around. They may see things in the background. Some people may see their reflection as something very, very different. Like I say, it depends on the individual. But here are some examples. So hallucinations, hearing voices. Now that could be a voice inside your head. It could be voices outside your head. Seeing things which other people don't see. So you could see like maybe a creature walk across, or a ghost, or something like that. Someone who's touching you who's not there. I've had that before. I've had someone kind of come and tap on my shoulder when I've been very poorly, or stroke my leg. That's been very, very scary. But like I said, the main thing for me was smelling, and that's the other thing, smelling things that other people can't. So that's the hallucination side of the illness. Now there's also delusions. So delusions is something that is basically a belief in something that isn't true. So people say that they're delusional, or they're deluded. This is another term that gets thrown around. But what does this actually mean? So some people may experience that they are being followed. They maybe even think that they're being followed by a secret agent, or that someone's out to get them. They may believe that they may have a delusional thought that people are trying to get them or trying to kill them, and this can be strangers or family members. Another experience is that someone may have planted something in your brain to monitor your thoughts. I've had something similar before where I've thought someone is trying to control what I'm doing, and that's when I was once when I had an episode and I tried to commit suicide. I had a voice very much telling me to take the pills, take them, and it was shouting at me, do it. So that can be really, really horrible. And yeah, sorry, that's not really the same as monitoring thoughts, but it's that voice in your head kind of thing. Some people may experience the more severe level that they have special powers, that they are on some sort of mission, and in some cases they believe that they are God. And I have one of my friends has experienced psychosis and has experienced the fact that they think they were God. And I've been around them when they're at this really manic level, and you can see that, you know, they're not themselves anymore. And, you know, it's very hard for the carer to see someone going through that episode. I'll talk about how to support someone in later videos, but, you know, for now, just see it as it's not reality. There's nothing actually there that's going to hurt you or scare you, you know, but it's the not knowing. And if you're seeing someone going through a psychotic episode, it's very, very scary. Excuse me. Just do your best to just go along with it with them, and we'll talk about how to support them at a later date. So some people may find these experiences of the hallucinations and delusions very, very distressing. And some people kind of very much after a while get used to it and kind of understand that it's a hallucination and can kind of work with it. So some people can be very high functioning and, you know, maintain a job and understand that these experiences are just part of their life now, whereas other people may have more acute episodes of psychosis and be absolutely terrified. And I've actually had a drug-induced psychosis years and years ago when I was doing more drugs and things like that, and I had a drug-induced psychosis, and I saw my reflection in the mirror, and I was bruised all over my body, and my hair was like straw, and it was, you know, so you can have drug-induced psychosis as well, and that's a very, very scary place to be. I mean, ideally, if you're suffering from any kind of psychosis or mental illness that can include that, then it's really best to stay away from really strong drugs. So the third one is cognitive experiences. Cognitive is coming up in my mental health jargon, so I'm not going to explain it here. Cognitive experiences are ones that relate to mental actions such as learning, remembering and functioning. So some cognitive experiences associated with psychosis are being unable to sustain attention. So if you're in that episode, you're going to be very, very hard to kind of keep their attention with that person, because they're going to be kind of maybe thinking elsewhere. Memory problems, again, they're coping with this psychosis, so they may forget things, they may not have the best memory because they're dealing with this. They're having to, you know, function as best they can, seeing and hearing or feeling these different hallucinations or delusions. Unable to take on information and poor decision making. So again, you're so immersed in your psychosis that day-to-day functioning will become impaired. Finally, I just want to talk about conditions that are linked to psychosis, and there's a few here. So we've got schizophrenia. That's probably the most common one, where psychosis is a very much a daily, a permanent part of your illness. So some people with schizophrenia will be in this kind of psychosis experience for more time than others. Bipolar disorder, this tends to happen when you go into your manic episodes, your hypomania. You can get so far that you can go into a psychosis. Schizoaffective disorder, another area that people experience it. Psychotic depression is another area. Postpartum psychosis, this is kind of like postnatal psychosis, postnatal depression, but you have the psychosis side of it. Organic psychosis, which is to do with maybe head injury or experiencing a physical injury. And finally, delusional disorder. Now, I don't have any of those illnesses. I mean, I have BPD, as you guys know, and when I've been very poorly with that, I have experienced psychosis, but I wouldn't say it's one of the main illnesses you experience it, but I have experienced it with that as well. So this has been Psychosis Part 2. Please join me for Part 1. This has been Psychosis Part 1. Please join me for Part 2, when I'll be going more into the illness and how it affects the brain and the different chemicals in the brain. For now though, I hope that's been giving you a really good introduction to psychosis. Thank you for watching. Please like and subscribe if you haven't already. Take care, and we'll see you next time.